We know that the CDC actually updated their number to over 1 million new cases of Lyme disease this year. And diseases that are like Parkinson's, fibromyalgia, lupus, autism, multiple sclerosis, chronic fatigue, Alzheimer's, neuropathy, arthritis, breast cancer.
Sure, autoimmune diseases.
Autoimmune diseases, they're all caused by underlying infections. The Infectious Disease Society of America is following old 2004 CDC guidelines. Those were intended for surveillance only. They were never intended to create patient guidelines. The state of Oregon is one of the worst states in the nation to get care. I personally suffered fibromyalgia for 30 years. I had to travel to California to see a Lyme literate doctor to get diagnosed this March. I'm finally starting to get better. I spent 16 months in bed. I'm on full disability and food stamps now as a result. Oregon's got to do a better job of this.
Okay, well, again, I work at the federal level. I support the research that's being done in vaccines and treatment. I work with a bunch of people who have actually proposed cutting research by the federal government and saying, oh, the pharmaceutical industry will take care of it. Well, the pharmaceutical industry only goes for blockbuster, profitable drugs and Me Too drugs. So it's essential we continue the federal investment and do a better job. But in terms of Oregon itself, we do have there's county health departments, there is a state, I don't know the state system very well because, that's not where I work, but I mean, it sounds like Oregon needs both the Oregon Medical Society in terms of educating the doctors and the state itself through the, however they do those things, should be communicating to the physicians in the state about the problem in a way that, they're
that's not happening. Oregon hasn't done a tick sweep in 10 years. We don't know what the infections are.
Well, I don't know if you live in Springfield, you'd have to get in touch with, your state senator and your state representative, and that'd be John Lively, and was there a state senator? Lee Byer, and see what the state is doing on these things. So.
Well, I will also share with you real quick that HR 4701 is a bill that's being looked at. It just got out of committee. It's going to the Senate or the House here shortly, which will allow all medical doctors in the nation to support Lyme patients without any fear of prosecution by medical boards. And we desperately need support on this.
Okay, well, I will definitely take a look at it. I probably support it. I've supported other legislation. Again, we had someone mention alternatives in the past. We've had doctors in Oregon prosecuted for following alternative treatments in the past, and I tried to pass legislation that would allow them within the scope of their licensure to use alternative treatments. If they're a full physician, they could use a wide range of treatments that aren't FDA approved, but aren't proven to be harmful. And I got to tell you, I teamed up with a very conservative Republican to work on it. We worked on that bill for years. We never got very far with it, but so this one sounds like something I could support.
Well, we see the same thing with doxycycline. It used to be a $50 a month antibiotic, and it's gone up to like $650 a month.
Right, and I just read an article recently where tetracycline, one of the oldest drugs now, used to cost like a penny a pill, and now that's a whole different issue with the pharmaceutical industry and the problems. Yes, sir.